Hello, everyone, and welcome to Heluna Health's Population Health Matters live stream series. We're so glad you could tune in today. My name is Sarah Lichman, and I'm the Director of Media Strategy at Heluna Health. We have a great discussion planned today, but before we get started, I want to remind those of you who are joining us live that we will be reserving about 10 minutes towards the end of the live stream for a Q&A session, so please submit any questions that you may have in the live stream chat. Today, we're talking about some exciting recent research in population health from our very own Dr. Jo Kay Ghosh and Dr. Blayne Cutler. So first, I'd like to welcome Dr. Jo Kay Ghosh. Dr. Ghosh joined Heluna Health in 2021 as Director of Research and Evaluation, bringing more than 15 years of experience in public health research and practice. She leads a robust research and evaluation program for Heluna Health. Dr. Ghosh has worked in both academic research and in public health practice with deep roots in environmental health and communicable disease. Prior to joining Heluna Health, she served as Health Effects Officer and Director of Community Air Programs at the South Coast Air Quality Management District. Previously, Dr. Ghosh worked at the Los Angeles County Department of Public Health, where she led the tuberculosis epidemiology team. She has conducted research in these roles, as well as at UCLA and USC, and has numerous publications in the fields of air pollution health effects, maternal and child health, and tuberculosis. Dr. Ghosh received her PhD in epidemiology from the UCLA School of Public Health. She holds a Master's of Public Health in Epidemiology and Biostatistics from UC Berkeley School of Public Health. Welcome, Dr. Ghosh.
Thanks so much, Sarah. It's a pleasure to be here.
And it's also my pleasure to introduce Dr. Blayne Cutler, President and CEO of Heluna Health. Dr. Cutler joined Heluna Health in 2014. She's a physician trained in infectious disease and public health. Prior to joining Heluna Health, Dr. Cutler served as New York City's Assistant Commissioner for HIV Prevention and Control under Mayors Michael Bloomberg and Bill de Blasio. As the city's Director of HIV Prevention from 2007 to 2013, during her tenure, new HIV diagnoses declined by more than 25%, and HIV fell off the list of top 10 causes of death among New York City residents for the first time in 30 years. Dr. Cutler has published widely on topics related to HIV, epidemiology, history, and public health. She has lectured at universities around the world and has assisted in the scale-up of HIV treatment and care in Africa. Dr. Cutler received her medical degree at the University of Pennsylvania, completed her residency training at Brown University, and her infectious diseases fellowship at Columbia University. Welcome, Dr. Cutler.
Thank you. It's a pleasure to be here.
I'm really pleased to have both of you here today. And before we get into the meat of the recent research, I want to talk a little bit about Heluna Health's research team and what we do. I know a lot of our program teams and partners probably know us best for the work we do in areas like contracts and grants management, or in HR, or as fiscal sponsors, but we also do quite a bit of population health research. Can you tell us a little bit about more about Heluna Health's research program in general, and tell us why it's so important?
Sure. Thanks so much for asking that question. You know, we started really growing our research capabilities in a very dedicated way about 3 to 4 years ago, in addition to enhancing our ability to help our partners with monitoring and evaluation of their programs or for programs that we work on together. We brought in Dr. Ghosh, who's, as you heard, an outstanding epidemiologist, and she and I began working together, and we built a team of researchers to lead our work. Our goal is not only to, I would say, maximally assist our partners in providing the monitoring and evaluation services they need, but also to help people really better understand what are some of the most pressing population health challenges of our time. And we're doing this through primary data analyses, through new national survey work, and other means. And increasingly, we're focused on 3 areas, I would say. Better understanding and mitigating the population health impacts of climate change, how best to address and improve and proactively improve outbreak preparedness, particularly at the local level, And finally, more equitably addressing the social determinants of health. I would say too, finally, Sarah, in addition to helping our partners, we really look forward to playing more of a national role in these conversations. So I just wanted to stop there and see if Jo Kay wanted to add anything as well.
Yes, absolutely. Thanks for giving that background in terms of how this department came to be at Heluna Health. So I am really excited about the work that we're doing. We have a small but mighty research and evaluation team. And as Dr. Cutler mentioned, lots of really, really interesting and impactful projects that we are pursuing at the current time. I do want to mention, though, it's like I know we're here talking about the research that we do, and we often call this team the research team. But I do want to mention that we actually do both research as well as program evaluation. And understandably, I think there are some similarities in terms of what is done for research or what is done for program evaluation, but there are some key differences where I see research as a line of scientific inquiry, right? So hypothesis testing, looking for research discoveries, scientific discoveries. Whereas program evaluation, the purpose of program evaluation is actually quite different. You are starting with a program and really critically evaluating that program, oftentimes using research methods to be able to identify the strengths and areas for improvement, to be able to quantify impact. Sometimes it could also, help with identifying why a program works or specific elements of a program that make it work, often through qualitative methods. But I do want to make the point that actually our team really does both. It does research as well as program evaluation. I know we are going to definitely dive into some of the kind of recent research projects that we're doing, but as an example of program evaluation, we've been working with our partners at the LA County Division of HIV and STD programs on a project that is within the Ending the HIV Epidemic initiative. So we actually have a program evaluation team that's dedicated on working on that project. We do primary data collection. We're working with several different clinic and community-based organization sites to do the data collection, analysis, and reporting for that project. So that's something that is an ongoing project and a wonderful project, a wonderful collaboration with the County of Los Angeles.
That's wonderful. Thank you so much for all that background information, both of you. Now, at the end of March, Jo Kay, you presented a poster at the National Association of County and City Health Officials Preparedness Summit in Cleveland. And that poster was titled Household Preparedness for Climate Impacts in the Western U.S. And this is such an important and relevant issue. Here out west, we can feel the impacts of climate change when it comes to things like wildfires and extremely hot days and things like power outages, which can really disrupt our lives and our ability to keep our families safe and healthy. I would love to hear more from you about that research. Can you tell us a little bit more about the survey and about what your team found?
Absolutely. So for this project, we were interested in assessing preparedness at the household level for certain commonly experienced climate-related impacts. So as you mentioned, wildfires, extreme heat, and related power outages. And I know when we use the term, for example, emergency preparedness, we think of having our earthquake supply kit, or potentially being ready to evacuate your home. And those activities are really, really important, but by and large, those events are actually relatively rare, right? The need to evacuate your home is actually relatively rare. Whereas experiencing, heat waves or, really, very poor air quality days due to wildfire smoke, those types of incidents are actually quite common. And so I like to think about this in terms of sort of everyday preparedness, right? Actions that people can take to help mitigate the risks of these climate events, such as knowing how to check your air quality on wildfire days or recognizing the symptoms of heat exhaustion and knowing what you can do about it. So for this project, we actually developed a questionnaire and conducted an online panel survey of about 1,700 adults who live in the Western United States. And through these questions, we assessed their preparedness for impacts from wildfire smoke, extreme heat, and also extended power outages. And so in this particular analysis that we presented at the NATO Preparedness Summit, we identified the gaps in preparedness for each of these types of climate-related incidents and compared preparedness levels among people who identified as a person of color compared to people who identify as non-Hispanic white. We identified certain barriers, such as not being able to make modifications to your home. So for example, if you're a renter, your landlord may not allow you to install an air conditioning unit as a preparedness action for extreme heat. Or perhaps you might have a lack of transportation to be able to get yourself from your home to a cooling center. We also identified lack of information and also some financial barriers, that are preventing certain people from making these preparedness actions. So I guess if I had to kind of summarize all of this into one sentence, I'd say really the bottom line is really that there is a need to invest in enhancing preparedness in vulnerable populations, such as through educational campaigns, as well as bringing resources, particularly for low resource households.
That's really great, really interesting research, Jo Kay. And now our research team focuses, it also focuses a lot on outbreak preparedness. And this is another great hot topic because as we know, the COVID-19 pandemic changed the way we think about outbreaks and about how our communities prepare for them. And I know you were co-authors on a paper that published late last year, which reviewed outbreak preparedness indices. And that was in the journal Preventative Medicine Reports. Can you tell me a little bit more about that study and about your findings there?
Sure, happy to do that, Sarah and Jo Kay. I would say that the genesis of this paper was really to survey the landscape and assess what tools currently exist that can really allow us to more proactively and better identify and prepare for the inevitable next outbreak we might face in the future. I think we all realize that COVID experience was unique, but not solo. It's very likely that we will face something like this again. And how can we be more proactively prepared rather than reactive to what we've experienced? So in many other contexts, such as finance, for example, there are clear indices that collapse a basket of measures into one composite measure to give people a clear and easy assessment for how an entity is doing compared to other entities. So when I mention finance, you can think, for example, of this Standard & Poor's or the Dow Jones Industrial Average, which takes kind of a basket of stocks and comes up with one, let's say, average number or one metric to give an indication of how the stock market is doing. And this can also be done in the domain of population health, taking different domains with metrics in them and bringing them together into one composite metric. And these indices do exist, and we really wanted to know, when we asked ourselves as a team, what outbreak preparedness type indices already do exist? What do they currently measure? How are they organized? And how can we help by ascertaining the gaps in these indices that need to be filled? So given that was sort of the genesis, we conducted a literature review of more than 3,000 titles covering these topics, and particularly those that address one of at least three areas that are important in this work. They are communicable outbreak preparedness, resilience, and vulnerability. When I say vulnerability, I mean vulnerability of a community to an outbreak or a health crisis, and resilience of a community to an outbreak or a health crisis. How easily do they bounce back from an event? such as an outbreak. And in looking at all of this work that has been done, that is out there, we found 59 unique indices that are applicable to assessing communicable disease, most of which relate to one specific outbreak, and they were not built to be generalizable to any type of outbreak that might come. We did find 3 indices that were both generalizable and assessed at the local level. So some indices are state-based, some are national, some are country-specific. But we were really looking for indices at the local level because that's where a lot of public health really happens on the ground. And so I would say that the results of our studies show that while many indices do exist, there really does remain a need for a local level generalizable index that can assess a community's strengths, its weaknesses, and can help communities address gaps before the next outbreak happens rather than after. And of course, we can talk about this later, and I think we will, but subsequent to our research, our team has built such a pilot, it really piloted such an index, and that's called the Community Outbreak Preparedness Index, or COPI, something that Jo Kay has worked very hard on. We're very proud of.
That's really great, and thank you for bringing that up, because that's a great segue into our questions from the audience, because I see one question has already come in and it's related to COPI. But just before we get to that, as a reminder, if you're watching us live today, please feel free to submit questions for both of our panelists in the chat. But this first question, it says, my team has really found the COPI, that's Community Outbreak Preparedness Index, useful. And this person wants to know, what is next for COPI, and will there be an update or new version coming?
Yes, thank you so much for the question. So, we, as Dr. Cutler mentioned, we launched our pilot version of the COPI last year. That was back in November, and this pilot version really focused on California counties. So that was really kind of the first our first effort in developing this kind of index. We are actually currently working on updating that data and targeting this fall to release our new version. And there will be actually a few kind of key changes. So first, we are actually going to be including a total of 4 states, so including California and 3 additional Western states. So we're kind of expanding this COPI tool more broadly into the Western region. And the second component is that we decided that this year's COPI should be focused on public health preparedness. And a big reason for this is because the work that Heluna Health does, particularly in the communicable disease area, we work with a lot of both state as well as local partners in communicable disease surveillance, outbreak response, as well as some intervention programs. And kind of as a sort of kind of stemming from our expertise in this kind of work, we wanted to really build out the portions of this tool, the public health portions of this tool, to really try to ensure that there is adequate investment in both the public health infrastructure as well as the public health workforce. And these two are both really important components to improving preparedness. I do also actually want to take a moment to kind of think about what we mean by preparedness. And a very typical definition of infectious disease preparedness or communicable disease preparedness is really the ability to detect, respond, and recover from an outbreak, for example. And so having that kind of infrastructure, really having that, surveillance infrastructure, having that workforce, that really helps build and maintain these types of systems is really, really a critical part of this type of preparedness.
That's really great work, and COPI is such a great tool. I'm not seeing any other questions from the audience at this time, but Blayne, I was just wondering if you had anything else you wanted to add about COPI.
Yeah, I do. I want to build on what Jo Kay was saying about being really excited about what's coming in the fall. Excited to expand this work to 3 additional states in the West, in addition to California. We're looking at Nevada, Arizona, and Utah, I believe. And we have a cadre of community advisors that are helping us with this work as well. And there's just quite a lot, as Jo Kay really mentioned earlier, there's a lot that we can do with these tools. They help, meaning when I say these tools, I mean indices that we're developing and other resources and tools that we can provide to those who are on the ground, whether you are a program, you lead a public health program at an organization like a public health department, whether you are a researcher or you are a local government leader. You know, these types of tools can help you assess longitudinally, how am I doing in terms of outbreak preparedness? Where are my strengths? Where are my weaknesses? What are the gaps that I need to address? That index is sometimes in the work that we do broken down so that you can sort of pull apart the metric to see where there are strengths and weaknesses. And you can also then allocate your resources in a more proactive manner to get stronger and stronger year on year. So, you know, my ask would be that look for COPI. All of this material would be on our website, and our social media can take you there as well. And once you have access to it and see what it is, use it. Make sure, let us know how you're using it, because we'd like to make, obviously, year on year, make it better and better for you. And so, you know, I hope you will let us know how you're using it, and we can do this type of research. And we want to make this index kind of iteratively valuable, is what I would say, for those that need it and those at our local community level.
That's wonderful. And again, I'm not seeing any further questions from the audience. And I think we're nearing the end of our allotted time here. But before we close the live stream, I want to give both of our panelists the opportunity to share some final thoughts. Are there any last thoughts that you'd like to share with our viewers? Is there anything exciting on the horizon that we should be looking for?
Let me just start by saying, and I'll say one quick thing, Jo Kay, and then I'd like you to chime in. I just did want to add that we've been talking today about different tools. We have also, and Jo Kay has led the launch of a biannual series of data briefs, which are really primary types of data analyses coming from national survey work that we are also doing annually, looking at what are some of these questions that don't get asked in the mainstream media that we can sort of add insight to. And from that survey work, we are creating these data briefs, which I think have also been very, very valuable and useful. And of course, some of the papers that we talked about today and research in the peer-reviewed literature. So Jo Kay, I wanted to make mention of those, and I didn't know if you wanted to say more about that as well.
Absolutely. Thanks for mentioning that. We are actually working on our next data brief, which is coming out about next month. And this next data brief is going to be focused on household preparedness for extreme heat events. So as we are kind of moving into the summer months, definitely something that is worth thinking about. I'd also encourage listeners to subscribe to our mailing list to hear about our latest research, and that way you'll get notified anytime we have new research tools and products come out, any reports, and you can do that by going to the COPI website, which is copi.helunahealth.org.
That's great. There sounds like there's so many wonderful things to look forward to, and thank you both so much for those kind of final words of what we can look forward to. And thank you for sharing with us today. It's been really a privilege to host this live stream. And thank you to our audience, whether you joined us live or if you're watching the recorded version of this, thank you for tuning in. Please make sure that you're following Heluna Health on social media. We're everywhere. We're on Facebook, X, Instagram, and LinkedIn. That's where you'll be able to keep up with all of the wonderful work of our research and evaluation team, our other programs and partners. You can find information about job openings and upcoming events, and that would include our next live stream. So tune in there, and thank you again, everyone, and have a great week.
Thank you. Bye-bye.